Hi everybody, welcome to the third episode of our Apollo Facebook and Instagram live feed. As you can see, we've taken the order of social distancing very seriously, and we have actually moved these recordings to remote locations now. Today's episode is going to be about medical versus recreational cannabis, the differences, the reasons why they exist, and how you should go about finding what's best for you. My name is Arash. I'm one of the medical graduates that works at Apollo. I spend a lot of my time working closely with the physicians and working closely with the patients, ensuring a smooth line of communication and understanding for everybody. Apollo was a company that started initially as a research institution. There was no other reason for us to pay attention to medical cannabis except for the results that we saw. Eventually, we graduated into a clinic, and we now are one of the biggest clinics and help people and patients from coast to coast. It's very important for people who are listening to know that. We can help anybody in any province. Really, we have a very vast and digital network. So, welcome. I'm going to dive into it right away. I have a couple of slides prepared for us, and then I'm going to get into the med versus rec points. But initially, I wanted to discuss trichomes. Now, I know I'm hearing a lot of, what is a trichome? I've never heard of that before. But guys, trichomes are these tiny little oily projections that come off of the plant. This is a microscopic photograph of the plant, the botanical, marijuana, cannabis. So, these tiny little oily projections are important because this is literally where the CBD and THC is found. This is where the medication comes from. A lot of people think, well, they take that entire plant and they make a medication out of it. No, they take the buds and they take the very high-end trichomes that have formed. They heat them up. The process is called decarboxylation, but really it's a fancy way of saying activation. Once the THC and CBD are activated, they attain a small concentrate from the plant, and then Health Canada gives them very strict guidelines into what they need to mix it with or how they need to suspend that oil. So keep all this in mind. Whenever you come across medical cannabis, it has been created from the plant, from these trichomes. I thought it was interesting. Maybe people at home don't think it is as interesting as I. So let's dive into it. Guys, I've got a couple of points that I want to run past you for medical versus recreational, and this is stuff that we talk about in clinic all the time, so it's important for us to understand it. So, medical cannabis is prescribed by your physician. Okay? This is somebody who will see you, will assess you, and will understand why you are attaining an opinion about a treatment option. Okay, and that's important to remember. A lot of times patients come to us and say, well, my doctor doesn't know enough, but what he gave me didn't work. Or, for any given reason, I haven't responded well to treatment. Can this help me? And our physicians have to assess, and they have to understand, well, with this set condition or with this problem, this is how we're going to approach it with medical cannabis. And it's also important to note, not everybody who comes to Apollo or is seen by us virtually will attain a prescription. Sometimes people are not in the right place in their treatment to try cannabis. Other times they are, and we're very successful, and other times they are, and we aren't as successful. But we have to try our best. We have to cater to everybody's needs, and we have to ensure that this is done medically because it's done safely that way. Now, recreational cannabis is something that is available to people, but it is seen as a form of enjoyment, as a form of recreation, right? So it's very different in the sense that it's not as measured, it's not as calculated, and we don't pay attention to the values of what occurs, right? If you ask anybody, when it comes to recreational cannabis, they think, well, I just, have this certain set amount that I like to use every now and then, and that's what makes me feel better. Or when I do use it, I sleep really well, and I laugh a little bit extra, but those are all things that we watch for in medical cannabis. Those are things that we want to avoid, right? So please keep in mind, medical cannabis has a very different stance when it comes to recreational. So that's one point I wanted to cover with you guys. Another point that I wanted to cover is when you go to attain cannabis from a recreational source, there's very little knowledge or understanding that is had from those people. I don't want to throw shade at anybody. There's nothing malicious about what they're doing. They're abiding by the law and providing a service and a product. But that doesn't mean that they fully understand what that does in our bodies. Okay? It's important to remember that. A lot of times when patients come to us, they will have a fear regarding medical cannabis. They'll say, well, I don't want to do this because I've heard this and this, and I've heard that and that. But guys, we have a firm understanding of what cannabis can do if used incorrectly, and then we create personalized treatment plans that stay beneath those levels. So here's a good example. A patient would come to our clinic and say, well, I'm looking to use this medication for pain relief. At the end of my day, I end up taking an Advil or a Tylenol just to help with my back, or my hip, or a headache, whatever it may be. A physician will counsel a patient and say, well, we have to ensure that you are a candidate, and then once you are, this is how you will start, and this is the dose, and we will graduate up in dose slowly. Again, it's a personalized treatment plan. Not everybody gets the same treatment plan, and we also fully understand that there is no such thing as a one-size-fits-all when it comes to cannabis, guys. In the recreational market, you have retail staff telling you what they have heard about, what they know worked for other people, and then suggesting the same for you. So again, it's a little bit different. It's a little bit different in terms of knowledge and in terms of understanding, in terms of treatment plan. Also, another thing that's important, all of these licensed producers are online. The only way you can attain medical cannabis, as I sit in my living room speaking to you now, the only way to attain medical cannabis is for you to have a prescription with a licensed producer, which is the online pharmacy, and they send the prescription directly to your home. With everything that's going on, they fully also understand that social distancing is important. They have made provisions and slight changes to how they ship medication to patients, but it's still arriving directly to your home. You are not going to a crowded space. You're not going to a busy store to attain this medication or to attain this product. So it's very important for people to understand that. Obviously, recreational stores have been available since 2018, October 17th, and that's something that everyone is welcome to take advantage of. But remember, in the current climate that we are in, that would not be responsible social distancing. You're getting very close to a lot of people. And I know that they have made provisions and changes to try to accommodate that, and they are allowing only a certain number of people in the store, and thank you to them for taking those provisions. Again, this is one step further in your protection. You wouldn't have to leave your home. One other thing that's important to remember is cost. And I want to talk about two things when it comes to cost. First, medical cannabis is generally cheaper than recreational cannabis. We have an average of between $4 to $8 per gram price, and then in recreational it's about $10 to $12 per gram, so we're right off the bat a lot cheaper. Secondly, it is tax deductible. When you have a prescription and you order from a licensed producer that is approved by Health Canada, you attain a receipt for that medication, and during tax season, which is now, you get to claim that on your taxes. So that's another advantage that we counsel our patients on, and it's very important for them to know. Very important for them to know. Last thing I want to talk about when it comes to the med versus rec is the ability for patients to have a consistent supply. We used to, not too long ago, struggle with that. We had a lot of issues with patients that were using a set medication, and when they went to order it again, it was no longer available, just due to supply and demand issues. Now, these companies, these licensed producers that are under very strict regulation by Health Canada, are also at the mercy of the plant, right? These lots and these batches take time to grow, they take time to mature, and then they have to manufacture that medication out of it. So along the lines, they figured out how to do this. They just got ahead of the game. What they said is that if we were to stop all productions now, we have a 6-month or a 12-month backlog of all of that medication that is available only to medical patients. Recreational stores do not have the same agreement with licensed producers. A licensed producer will grow for recreational stores, but they don't guarantee any supply, and high CBD is a very, very difficult thing to find for most recreational stores. Again, just due to supply and demand. So that's very important for us to know, guys. Lastly, well, two things. First, the possession limits. Everybody is entitled to carry up to 30 grams of cannabis with them, and you can travel with it federally across the country. You cannot leave the country with it. It's not an international clearance yet. Okay? Now, I'll talk about that on our next episode. We have a piece on that because it's very important for people to understand that. There's a lot of fear that comes from thinking, oh my goodness, I can't leave the country with this medication. Guys, that's not true. Right? I'm addressing it now just to ensure that people understand if you have a prescription for medical cannabis, there are no restrictions to your travels. You are simply not allowed to take your medication with you, although it may be available where you are going. So that's just a prelude into what we will discuss next time. Possession limits are important for patients because If a patient is traveling for a longer period of time within the country, they are allowed to carry their medication with them. So again, more legalities. And we can counsel that to any patient who is asking. Another one that's important is method of consumption and place of consumption. There's a very popular misconception that if I see somebody using a vaporizer or dry form cannabis, they're using recreationally. Guys, that's not the case. A vaporizer is a medically cleared device from Health Canada. We counsel patients on this if it's necessary. You can attain pure CBD dry flower and put that into a medical device. Once that has been put into the medical device, a patient is allowed to use it and vaporize it anywhere they wish, as long as they're abiding by the correct bylaws. Whereas if you are a recreational user, the same rules do not apply, and you can be assessed or addressed by by the police or whoever's enforcing bylaws, right? So if you have a medical license and you have proof of that, you are able to use your medication anywhere you need it. And that is something that anybody can check as well. Once you are registered as a patient with the connection stopped. Once you are registered, you are able to do these things, and you are able to carry the additional possession amount. Sorry guys, I'm just going to see if I can fix this for us. So, last thing I want to touch point on before I get into the questions is the medical standard that is set forward. Okay, quality control. Each batch of medical cannabis is tested by Health Canada. Okay, it's important to remember that. Health Canada has more rules for licensed producers than it does any other type of medication or pharmaceutical right now. In the recreational market, there's still a very strict process that they adhere to, but because there isn't a batch-to-batch checking, when you go to a recreational store, they will very clearly tell you, well, it'll start at this percentage, and it'll go to that percentage, and this is the strain that we have. We're not 100% sure what it is, but we know it's an indica between 12 and 30%, or between 12 and 18%. They don't give you that much of a range. But still, it's not as monitored as often as it is with medical cannabis. Those are the points I wanted to go over, everybody. I'm going to take a few questions from the live feed. And again, I have one or two from last week that I didn't get to that I thought were excellent questions. Thank you so much, everybody who was logging in and everybody who was sending us questions. I really appreciate it. First question, what is the difference between vaping and smoking high THC and CBD flower? Can oil be vaped? Okay, there's a whole bunch of questions there. There's a whirlwind of questions there. So the difference between an inhaled form of any medication versus an ingested form is how it goes through your body, how it's broken down in your body. First, when you inhale a medication, it goes into your lungs, past the capillaries, into your bloodstream. It's a very fast-acting medication, right? If you think about it, an asthmatic who needs an inhaler or a person who's attaining oxygen is receiving that chemical compound very quickly. And the same is true for cannabis. So it can give immediate relief, and there are certain conditions and times in which that is very necessary. When you ingest cannabis in an oil or capsule form made from the trichomes that I showed you earlier, it's important to remember that first-pass metabolism is required. You ingest it. Your liver is the organ in charge of grabbing up and redistributing all fats, so it does that, and it takes about 1.5 hours to 2 hours to kick in, but it should last you anywhere from 6 to 8 hours. When inhaled, it's pretty immediate, but it only lasts about 1.5 hours to 2. So that's the difference between that. Now, can you attain high THC and CBD strains? Yes, but we always recommend we start with the low THC and higher CBD to see if there's a medical benefit. Sometimes patients react very well to higher THC, and that's what they require for sleep. That's what they require for pain relief. But not everyone is the same, and we want to ensure that we start at the lowest point possible and move up slowly. The second part to that question was, can oil be vaped? As of right now, as I sit in my living room speaking to you guys now, the licensed producer oils that are designed and created for medication are meant for ingestion. In the future, they may be coming out with vapable devices that have a set amount of oil in them, but again, that would only be if they were approved by Health Canada for us to use medically. They may go recreationally with that component of it, I don't know, but one way or another, we're going to ensure our patient's safety. So as of now, those oils are not vapable. They're just meant for ingestion. Great question, though. Thank you for bringing that. Next question. I suffer from severe panic attacks. Is there a CBD-THC combo that you can recommend for me to try? I have been using THC alone which isn't really doing what it should to control my panic attacks? Okay, guys, this is a bit of an advanced question, so I'm gonna step back and give us some bearings. Panic is a form of anxiety that it has a very rapid onset. When it occurs, it has a lot of physical symptoms. Sometimes there's no reason to it. Sometimes it's out of our control. Other times we have triggers, right? Those are all things that we know about panic. Anxiety is when when that condition or those symptoms are present over a long course of time. So, when it comes to panic attacks, an inhaled form might be appropriate, but also what's a better approach is having an ingested form over a long course of time. Here's an example. If a patient comes in and tells us, well, I have about 2 to 3 panic attacks a week, and I have no idea why, and it takes me about 2 to 3 hours just to calm myself down so I can get back to being functional. So what we would do in that case is initially start them with CBD, give them the dose, tell them the dosing schedule, and then touch point in 4 weeks. In that course of over a month, when you were having 2 or 3 a week, what is it now? And if it went to, well, it only happens 2 or 3 times a month now, then we've made a difference. Then that's a treatment option for you. If it doesn't change anything, well, then we have to address that with either bringing in the inhaled form of CBD or bringing in a small dose of THC. Not enough for a person to feel the unwanted effects of THC, but to further assess the benefits of using THC in a receptor-mediated system in our body. So it could help them. It could help them. Again, that would be something that I would want to have a much greater understanding and medical history of before I just rattled off what I think we should do. Guys, it's important to recognize that these presentations are coming to you from an educational standpoint. If anybody wants true medical advice, I urge you to make an appointment so you can speak with one of our healthcare professionals. I promise you, you'll be in good hands. They're all very professional, and they all fully understand that medical cannabis is seen in a bit of a different light, so they put even more attention into the treatment options that they give people, into the treatment plans that they give people. Great question. Thank you for that. Here's the next question. This one's relevant to the topic and our current climate, so I'm going to take this one on. I walked into a dispensary, and they were unable to give me proper advice on cannabis for my anxiety. What options do I have? Well, it seems like a very simple answer. The answer is make an appointment with a healthcare professional, make an appointment with a doctor, and of course, here I am promoting that. But in reality, you cannot expect anybody who works at a retail store to give you medical advice. Guys, in the current climate that we are in, there's a lot of people giving their advice and what they think is best and do this and do that, and we have to change this and we have to change that. My question to anybody who's giving out medical advice, or if you're going to listen to anybody with medical advice, what are their credentials? Where's that information coming from? A patient told me the other day that he listened to a long podcast from Bill Gates talking about all the different things that we should do for the current COVID situation. But in reality, last time I checked, Bill Gates was a technology guy and a businessman, right? So we have to understand that any advice coming to you has to come from the right source, and no better source than a physician. Now, going back to the question, a retail store employee is not going to have the qualifications. He's there to help. He has great intentions. Unfortunately, he doesn't have the tools to give you the proper advice. So the answer to that question is simple. Yes, you can make an appointment. All appointments are free of charge, guys. There's no fee or payment for anything to be seen by a healthcare professional with us. So my suggestion is to make an appointment right away. Okay, next question. I use Lyrica at night for pain. Lyrica is the medication known as pregabalin, just for you guys at home. It's important to know. Once I find a level of CBD that works, so once I find a level of CBD that controls my pain, will I have that grogginess in the morning? Okay, grogginess in the morning could be a sign of a medication that is still in your system, okay? Pregabalin is a medication that has many, many different uses. And when a doctor gives you a prescription for a medication that was initially designed as an anti-seizure medication but now helps with pain and sleep, it's called off-label use. Okay? So that physician has given you a prescription that's off-label, very common. We see it all the time. I'm not saying that it shouldn't be done, but that grogginess that you're feeling, my assumption is from the question that that's from the Lyrica. So if we use Lyrica and it is helping you sleep and it is relieving your pain, what we will do is we will start and leave the Lyrica the same. We will start with a low-dose CBD and come up into a point in which you feel that you are attaining a benefit. Yes, the pain is a little better. Then, once we've gotten to a point where the CBD is in control of your pain, we can start reducing the Lyrica. It's called a weaning schedule. And that always comes from your healthcare professional, guys. Usually, it comes from the prescribing physician. That way, they are in the knowledge and they're in the know of you using another medication, another class of medications, cannabis-based medications, to treat your condition. So, another great question. That one gave us a live example. We can talk about actually some of the things that we address when we are in clinic. So, thank you for that. Would it be okay to share my prescription with my partner for CBD to be more calm and relaxed? Okay, so my assumption is this person is using CBD and wants to share the positive results they've had with their partner. This is very common. This is very common. Not just with cannabis, with all medications, guys. The other day we had patients talk to us about how they were trying each other's medications. And this is, they're not even related. And a patient said, well, the last time I hurt my hip, the doctor gave me this, and that's different from what you got this time, so go ahead and try this one. It might work for you like it did me. And now you have a patient who's on an NSAID that could potentially interact with other medications that is, as a physician, that doesn't know. So there's lots of red flags there, guys. Anytime a medication is shared, it's not correct. But what I urge patients to do, and what I urge them to do in clinic, is be seen, have your partner be seen by a healthcare professional, then have them have a prescription. Now you are legally okay for both of you to use the same medication. It doesn't matter because you both have a prescription. And now every doctor is in the know. So the next time something happens and he goes to give you a prescription, he understands, wait a minute, this person's on cannabis-based medications. This is the antibiotic I can prescribe. This is the sleep aid I can prescribe if needed, right? Again, that's the reason why we want a full medical history, and that's the reason why we ensure any doctor who is involved in your treatment is in full understanding of the medication that you are using. So going back to your question, yes, your partner can use some of your CBD. Should they? Legally, they're not allowed to, and ethically, it's better for your doctor to know. So I don't see a reason why you wouldn't make an appointment and have a healthcare professional assess your partner the same way you were assessed. Good question. I wonder if the partner has the same question or the same agreement in terms of needing the calm. All right, everybody. Last question. Why should I go to a doctor when I can just walk into a store and purchase it there? Guys, all the things that I have been saying, again, one quick repeat of it all, I guess to put it all into one statement. Price, availability, social distancing because it's sent directly to your home, quality control, and an assessment by a healthcare professional, which I think is the most important. Sometimes I think it's important for my own selfish reasons, and I'll explain that to you guys. If you see a doctor and you attain benefit from a set condition, I'm just going to pick any condition. Let's say you suffered from migraines, and you came to our clinic, and the appropriate dose of CBD was discussed, and the appropriate method of consumption was discussed, and you went ahead and tried it, and you were able to come off of a class of medications called the triptans. Sumatriptan is the medication that's used when a doctor doesn't have any other options for migraine treatment. They give you this. So you're no longer using NSAIDs, you tried triptans, and now you're on CBD, and it worked. Then we're able to reduce the triptans and stay on just CBD, and you have a high level of functionality, and you also state to the doctor, well, my migraines get really bad when the weather changes. During spring and fall, with all the barometric shift, I get really bad migraines. That's a common thing we hear. I'd like to use it during those seasons. And the physicians will say, well, by all means, it actually makes me happy to hear that you are in that much control of your signs and symptoms and you're understanding it that well. So for any given reason, a patient can come in and tell us that, but not tell their family doctor, right? So one of the important things that we do is get in touch with family doctors or other healthcare professionals that are involved, and then we record it. And that's where my selfishness comes in. I want to know how many patients we are helping with migraines. And if we have a large enough number over a long enough period of time, well then guess what? We can address that from a research standpoint, create a study, and we may in the future change the standard of care, right? So that's called turning the dial of human understanding, and that's something we're so proud to be a part of at Apollo. And everybody always wants to say, well, these are the things that we need to have in order to use a medication. Well, guys, every single medication that's being used has had that time frame to catch up. Cannabis is doing the same now. So, another great question. Another excellent question, guys. I'm going to take one more look here, see what we have. One more question. Okay. Well, again, very relevant because it talks about a dispensary. I was given some directions from my dispensary for an oil to use, and I took too much. And I didn't feel comfortable, and I got high. What can I do when this happens and so it doesn't happen again? Okay, well, let me address that from a couple standpoints. One, be thankful it was cannabis and not another medication that you took too much of, right? There are too many side effects out there that we are worried about when it comes to modern day medications. Cannabis, yes, you will feel unpleasant. Okay? A lot of patients explain it as having one too many glasses of wine. Now, if that's the case, the remedy is a nice comfortable chair, some vitamin C, and your favorite calming tea. It will pass. Many patients report that this happened, and I don't want that to happen again. And my response is, well, we now know what we don't want to feel. Okay? We've learned that at that dose, you were uncomfortable. So we will start far lower than that and move up slowly. All right? That's how you ensure it doesn't happen again. Secondly, if you had an appointment, this would have all been told to you in the beginning. Now, again, I'm going back to, it sounds like I'm throwing shadow at dispensaries, and I'm not. These are companies that are set up for retail purposes, and they are helpful to some, and other people use them for exactly what they are, which is recreational. But if you came into our clinic and you mentioned that you had some pain and you wanted to address it and you didn't want to take any more Advil or Tylenol, well, then I would counsel you. And I would say, well, the physician will counsel you, and the treatment plan would be written for you to understand that CBD is the first thing we're going to use. CBD has no psychoactive effect. And then afterwards, if it addressed your pain or if it didn't, then we'd step into the world of THC. Coming into medical cannabis with THC first is not the right approach, guys. It's not the right approach. Although we understand THC has a very important place. All right, guys. I think I'm going to conclude here because I have a few things to tell you. First and foremost, next week we do not have an episode coming because of Easter, so keep that in mind. We will not be having another episode next week, but we will catch up with you the week after that. So happy early Easter, everybody. Stay safe, stay indoors, and remember that social distancing is not a choice but a responsibility. There's a big difference there, everybody. That being said, I think I've concluded and I've said everything I said. Again, thanks for joining me, and hopefully we will see each other the week after Easter.